Hi, good morning, students, and happy Monday. Um, I've I've got some nursing tips for you here again, and thank you. Many of you sent me little notes that it was helpful last week, so please continue to send those. Tell me what you like, how I can help you, because this class again is not intended to add any stress to you. It's here to help you, and I'll take any suggestions of how I can best help you. Okay, so this is just a quick sort of recap. I wanted to tell you kind of from last week regarding, this is tips for real life and for taking tests, pharmacology, memorizing side effects of, you're gonna see common drugs that you see all the time and kind of knowing what are the expected side effects and what are the possible adverse effects that where you would want to instruct your patient to press their call light, or if they're at home to call their doctor or healthcare provider. Here's a little sort of trick for if you don't know a med's side effects on a test. So pick the system where the drug is working. For example, if you know it's a GI drug, pick diarrhea as a side effect. If it's a heart drug, pick tachy, where all of a sudden they're going to get an accelerated heart rate. CNS drug, pick they're going to be drowsy. It's going to overdo its job. And anything that's PO given by mouth and you're not sure, pick a GI side effect, because those are most common side effects. And that's what we talk about, like we talked about a couple of weeks ago, whether the medication should be administered on a full stomach or empty stomach, that sort of thing. Okay, a couple other tips here. Med Surg, the first thing you assess, like I said, brain or level of consciousness. So that's really important before you jump to any interventions, to assess, know the baseline of the patient and assess their current level of consciousness. And then once you assess that, it's airway. What is the first thing you do is you make sure they can breathe, right? So if you go in and the patient can't breathe or they're not conscious, the first thing you're going to do, right, is try to make it you're going to call a code, but you're going to try to figure out a way to get them more comfortable or whatever it is that's obstructing their airway, because you guys might have heard that expression, brain is time. We use that regarding stroke. So, excuse me, time is brain. I said it backwards. Time is brain. So if you're not getting air, and if there's a problem neurologically with the brain, then long-term damage happens. That's why, like you'll see that on a stroke unit or in hospitals, they actually they keep track of how fast they respond to a stroke patient. And they want to do it in less than an hour, because research shows that if you have an intervention when a patient's had a stroke, and you can start those interventions and meds or whatever they need based on whether it's ischemic or hemorrhagic, the better outcomes are if it all can happen within an hour. Okay. Little bit more general guessing skills. I think I mentioned this last week too. If two answers say the same thing, they're likely both wrong. If two answers are opposite, probably one of them is right. And then the sort of umbrella thing, which answer is more global? That just means that that would be great. That would be better to have an answer that just sort of covers everything than a more specific one. Okay, then always think, what is the worst that can happen? And I have an example of a question for that. So sample question is, post hip replacement, what is most important to do? And again, you're looking for key words. So all of the answers, we presume, are going to be important, right? They're going to be part of the teaching. If you look up, how do you care for a patient who's just had a hip replacement? All of these will likely be listed. Okay, let me just, page break isn't ideal here, but okay. So number one, sips of water. Okay, that's good. We would want to do that too before we post-surgery give them any real intake by mouth to make sure that they're not going to throw it up, right? Put the side rails up. Okay, that's important, right? Because we don't want them to fall. Give pain meds. That's important because they're going to be in a lot of pain post hip replacement. That's a major surgery. Use an abductor pillow. That's a really big deal too, because they can't cross their legs, and there's certain positions that are required with an orthopedic surgery that we must adhere to. So then you ask yourself, shoot, these are all important, but it doesn't seem like any of these are life-threatening. How do I figure this out? So you ask yourself, what could happen if I didn't do this? So that's back to this thing. Always think, what is the worst that could happen? So if you don't give them sips of water, They might be thirsty. You're not sure if they can even tolerate any fluids. They might not be able to eat as quick. That would be bad. If you don't put the side rails up, what's the worst that could happen? Okay, this patient just had hip surgery. Well, they could fall, right? And that would be really bad, right? If they fell out of their bed and damaged the fresh hip or hit their head or something worse. Give pain meds. Okay, they're likely in a lot of pain, right? What's the worst that can happen if you don't give pain meds? They're going to be in a lot of pain, right? And are they going to really seriously hurt themselves or die from even a 10 out of 10 pain? I don't think so. Using this abductor pillow, it's really important to follow the doctor's directions, make sure they're comfortable, make sure that their legs are aligned that the way they should be. What's the worst that can happen? Well, I guess if it was a severe sort of contortion after surgery, they could dislocate the hip. Very, very unlikely though. More of these are interventions for once they've been post-surgery a little bit longer and to instruct them for when they get home. So I hope that just based on kind of breaking it down like that, by what's the worst that can happen, you recognize that it's put the side rails up, right? So this might not, in a different patient population, may not be your most important thing to do, but just with this little bit of information, you don't know how old they are, you don't know if they're a boy or a girl, you don't know what comorbidities they have, but you can recognize what the most important thing is to do. Okay, so that's just another tip for you. Okay, now what I'm going to do for you is I'm setting up kind of this week's little lesson, and it should be very easy for you, and I hope that it will really help you. I might have mentioned before that when I was in nursing school, and even still now, to understand things, I'm very visual. I like to draw diagrams, even though I'm not a good artist at all, and sort of label them with colors and highlights. And so I like to draw out whatever the system is. I like to draw out the person. I like to write things down. And that act itself helps me remember stuff. Even if I never look at that list again, the thing that I wrote it, and if I say it to, I'm one of those people, if I read it aloud, not just in my head, and say it, there's something about that that kind of solidifies it and makes it easier for me to sort of get in the future, to be able to retrieve that information in the future, like on a test or with a patient. So what I have for you is 3 different things, and it's totally, hopefully this will be easy and you can do it however you want to do it. Okay, so the 3 different things, it's all related to the abdomen, and I've been getting referrals in first semester where your instructors are asking you to come to me because it's very common that it's like, oh shoot, where do I listen to the heart? Where are the lung sounds? What even is here? What are the organs in the abdomen? What could this possibly be when I'm feeling it? So here's just a couple little tips for you. And I loaded a bunch of these on Canvas too. So this idea of ape to man, I really like mnemonics to memorize things. And if that's for you, it might help you. And there's different ones too. I just learned ape to man and always sticks with me, of the different heart sounds. And so it's the aortic, pulmonic, this Erb's point, then the 2 is tricuspid, and then the man is just, so this starts one word 2, and this starts the second word man. So that's kind of why I write it like this: capital A, capital P, capital E, then capital T is tricuspid, capital N, M is man. Now there's not 2 more sounds down here. It's just kind of, like I said, a way to remember it. And to remember, you want to be able to remember too, what is the point of maximum impulse, where you can hear it the most, which is down here in the apex here. So like if you're getting the apical pulse, this is where you're remembering it. And I like pictures that have the ribs on them too, because it helps sort of, you could do it maybe like on yourself, and you can look in the mirror, or a family member, and remind yourself, like, where are these? You could do it in relation to landmarks, like where like a typical nipple line is. You could do it with the ribs based on what you feel. But you want to come up with your own system. So it's easier when you're doing a physical assessment, especially when, we get nervous if your nurse or professor is watching you and checking you off, that you're pretty close to where you want to listen. Okay, so there's all this stuff I put on Canvas, like I said. Then I put on there also a little blank guy. So I have some that are totally blank and then some that sort of have the sounds. And this is sort of the order that you go right over here and feel this landmark here and go over to hear the sounds. So maybe that helps you. You could basically what this assignment is, guys, is I want you to pick one of these little blanks that I've put on Canvas, and I want you to make it your own. Put some colors, put some words, just do one and kind of please actually find a way that you can possibly use this week. And I would love to hear feedback of how it works. So what you'll do is you'll print one of these, do your little drawings, do your words, whatever, however your brain works. You could even record something with yourself talking, and you could turn that on Canvas too. You can do little videos. If you don't know how, you can Google that, or I can tell you how to do that. It's actually pretty easy. Whatever. So if your brain works better, where you'd rather show sort of a demonstration, that's fine. If you want to draw it with words, colors, whatever, you can tell that this is really, it's for you. So do it on what works best for you. Okay. So then this is for the lung sounds, and it's a lot of students, it's so confusing. What order do you go in? It's like this. You don't want to lift your stethoscope. Where are the sounds? Again, so it's boop, boop. This is on the back, and then you're not going to lift your stethoscope. Then you lift it again here, lift it again on the front. You don't lift it. You go like this. So this kind of shows the nipple line as a guide. It tells you the sounds that you might hear, if that works for you. And then this is more without the actual skin anatomy. And just pointing more to landmarks, bony prominences. This doesn't actually have the ribs drawn. This may be something that works better for you. I think I have another, then there's one like this. So just finding a way that would help you remember the order and where are the landmarks on how you would listen to lung sounds on a physical assessment. Okay. Okay, so then this one is showing you where the different organs are on a human, right? So when you're palpating, or and a patient says, "Oh, I feel pain there," you ask yourself, "Shoot, I don't even know what that could be. Could it be the liver? Could it be the pancreas? Would you even feel the liver if it was inflamed? Could it be related to their digestion? Could it be distension because of gas?" So just at some point, you want to kind of find a way to have a general idea. You don't have to memorize it, but you want to start to know as you're going through this semester about what you possibly could be feeling and what organ systems are sort of under this, obviously under the skin and the abdomen. So here's a little illustration for you. And I think I have one with the quadrants here too. Okay, so then here's another. And this just sort of shows you the quadrants. And I know that you guys know this because you listen to bowel sounds. And that actually goes in this order too, starting here to here to here and down here. You could include bowel sounds on your drawing too. Or if you find a blank drawing online that you like better than the ones I've provided, you could do that too. You could free draw it. However, just show me that you kind of like, if possible, there's a way that this could help you this week. And you don't have to reply to other students either. It's just going to be, you turn it in straight to me and just show me how this may have helped you. Okay, okay, so that's all I have on this actual presentation. Oh, I guess I don't have the heart sounds. My goodness. Or did we already show you that? Oh, I did. Okay, so you're going to see these samples and more on Canvas. And as always, feel free to drop me a note if you have any questions, and hope you guys have a great week. I'll make this due. How about let's do Saturday at midnight, just one thing you have to do so I have time to grade it before the next week. Okay, have a great week, and thanks for stopping by. Bye.